Hi, I'm Karen. Welcome to my talk for Hope 2022. It's called Hack Cancer, How Hackers Can Help Save 9.5 million lives a year. I'm going to start by telling you a story. It's my story. It's a nightmare really, but there's still a chance it could turn into a fairy tale. More on that later. So in July 2016, so it's 6 years ago, I was suddenly diagnosed with terminal cancer. I was 36 at the time, two young kids. My son was 8 and my daughter 3. And I was not really given any time to live. Realistic life expectancy was 7 to 9 months. That's with treatment. The cancer I had, or cancer I have rather, is bowel cancer, colorectal cancer, one of the most common cancers and one of the most common cancer killers in most countries. I found that the cancer had spread to the abdominal membrane, and that's why the life expectancy was really 7 to 9 months realistically. I quickly found out that in the UK there was no serious treatment being offered. I could have some treatment to help extend my life a bit, maybe reach that 9 months, possibly a bit longer. So I was 36. I might kind of do slightly better than the average, but I found out there were very few outliers in 2016. So typically, cancer patients with colon cancer spread to the abdominal membrane got sort of 7 to 9 months of life after diagnosis with treatment. So things were looking pretty bleak. Fortunately, a friend of mine, Eben Upton, who you probably know of, he's my co-founder of Raspberry Pi. He told me that there were still some of the HIV patients alive from like the first waves of HIV in the 1980s. He said what had happened was some patients would get access to new drugs through clinical trials, and this would give them a little bit longer to live, and then another trial would come up and they'd get a bit more time to live, and it was like they were kind of riding a wave of new drugs. And of course now HIV is manageable as a chronic disease, and in fact recently I think there's been some curative treatments as well. So that was my intention. Could I get access to some new treatments and live a bit longer and make it through this? As you might have gathered, I lived a lot longer than 7 to 9 months because I'm here now 6 years later. So yeah, my story is basically I realised there was no proper treatment in the UK. I had the option of treatment in Japan because I'd been spending the past past few years before the diagnosis. I'd been dividing my time between the UK and Japan, most of the time in Japan. So I knew I could get treated in Japan, and I had heard the cancer treatment and healthcare in general in Japan was considerably better. I had not really had any healthcare in Japan, but I had heard it was very, very good. Cutting edge treatments, really high standard of clinical excellence everywhere in all parts of the healthcare system, with the notable exception of mental health, but that's a topic for another time. So I went to Japan and started getting treated. I went through a lot of treatment, had 4 years of surgeries, chemotherapy, various chemotherapies, molecular targeted therapy, various radiation therapies, metabolic therapy. I had hypothermia therapies, so heating up the cancer tumours to damage the cancer and make chemotherapy work better. So I basically had all the kinds of cancer treatments except for hormone treatment. That wasn't relevant in my case. After 4 years of doing 7 kinds of treatment and doing many of them repeatedly, I got to the stage called NED, N-E-D, no evidence of disease. And my immunotherapist said, you've got to this stage, but you should keep doing treatment for another year to make the chance of the cancer returning much lower. So I did another 12 months of low-dose chemotherapy. So this is chemotherapy where you have a low dose, but there are no breaks. It's just chemotherapy every day. The side effects are better than regular chemotherapy, but it's still, kind of unpleasant. So now I'm a real outlier. My kind of case is actually going to be written as a paper by a Japanese surgeon, and kind of provides a case study and a pathway for patients to hopefully get curative cancer treatment. In my case, if I can stay with no evidence of disease for another year, so I've had 2 years so far, no evidence of disease, and for the past year I've had no cancer treatment at all. If I can stay for another year, probably by getting some more immunotherapy, when I get to the 3-year mark of no evidence for disease, the chance of the cancer recurring drops off dramatically for colon cancer. And it's different for different cancers. Some cancers, tend to recur in the first couple of years. Colon cancer, first 3 years. But if I can make it to 3 years with no evidence of disease, then the chance of the cancer coming back drops off dramatically. And then this story really could be a fairy tale, not a nightmare. So I'm going to just give you some background information of understanding cancer. And then I'm going to talk about my kind of blueprint for curing cancer. And finally, how you scale that cure so that everyone everywhere can get really effective cancer treatments. There's obviously big financial barriers in some countries. So, background for cancer. So I'm going to explain what cancer is, why you should care, why there seems to be so much cancer around, and why is it so hard to treat, and particularly why does it seem impossible to cure. So what is cancer? Well, cancer is a group of diseases, and they seem to be diseases at the cell level, so to do with the cells of the body. This may not be correct. It may be more operating at a higher level. There are various models for trying to understand cancer, but the cellular model seems to be at least useful. And it's a set of diseases that are to do with cell division and cell death. So what happens when cells divide, so when you get new tissue growing, and what happens when cells are meant to die. And I think you can probably guess that, cancers, there are many issues with the cell division. You see this sort of rapidly dividing cells, these tumours growing inside people. And cell death, you hear about, people talk about the cells ignoring the signals to die, or hiding from the immune system so the immune system doesn't kill them. These kind of cells, when they become cancerous, they form these tumours and they spread. So there are non-cancerous tumours, but one of the key points is that a non-cancerous tumour doesn't spread. It might grow a lot, it might cause a problem if it's pushing against an organ or against some nerves or whatever. But a non-cancerous tumour shouldn't spread around your body. Non-cancerous tumours can become cancerous, so that's why, it's a good idea to get checked out medically quite regularly for that kind of thing. So it's kind of unique that cancer can spread around the body. It's very odd because when rogue cells are like floating around in your blood or your lymphatic system, they're recognized and they get killed. If they make it to somewhere, they shouldn't be able to like stick on to the side of an organ and start multiplying and growing. But cancer cells do, right? Cancer cells get past the many mechanisms that your body has against cancer. So that's what cancer really is. So it's a group of diseases. We usually talk about cancer in terms of the organ it started in, like where's the primary tumor. That may be less useful in the future. Maybe it's more important to look at the genetic mutation that caused the cancer. We're not really sure yet. So I say we. I know quite a bit about cancer because I've got it. But yeah, I'm not a doctor, so I'm not giving any medical advice at any point in this talk. And I never would give any medical advice because I'm not a doctor. Okay, so yeah, we talk about like where the primary tumor was. So in my case, for example, primary tumor was in the sigmoid colon, which is the S-shaped bit of your large intestine. And unfortunately, when my cancer was found, it had already spread to lymph nodes, liver, abdominal membrane. Later, it spread to my right lung as well. So next, why should you care? Well, the very short answer is that either you're going to get cancer or someone close to you will. Now, that's the reality in 2022. I'm working on changing that reality for you and other people in the world. More of that later. But yeah, that's the reality basically, is that you're going to get cancer or someone you know has or will get cancer. And obviously we need to change that. So what we need is effective cancer treatments that don't destroy your body and that are affordable for everyone, everywhere. So that's what I'm working on. You can find out some of the stuff I'm doing from my website, makecancerhistory.jp. That's JP for Japan, so makecancerhistory.jp. If you want to find out more about my personal story and how I am alive 6 years after a terminal diagnosis with 7 to 9 months to live, if you go to hackcancer.jp, so that's hackcancer.jp, that forwards to redirects to my GoFundMe page, and you can see the updates there. I've done, I don't know, almost 100 videos about over the past 6 years I've been doing videos about the treatments I've been having and the results and that kind of thing. So if you go to hackcancer.jp, you can find out all about my story. If you go to makecancerhistory.jp, you'll see the work I'm doing here in Tokyo to try and make cancer history. So next question is like, why is cancer so common? Lots of high profile cancer cases. You certainly know people with cancer. You have to be a bit careful because of course now, I say now, but recently we have a lot of social media, so we hear about things maybe that we wouldn't have heard about in the past. It does seem cancer is becoming more common in young people. That could be due to environmental factors. It could be lifestyle issues. There are kind of some odd things like the number of non-smokers who get lung cancer is going up. So maybe that's due to pollution, maybe air pollution, obviously. But it could be other forms of pollution as well, because some pollutants are co-carcinogens, so they work with other things to cause cancer. So there could be pollution in water that's combining with other things in your body, causing lung cancer, for example. And of course, I mean, people are living a lot longer now, which is a fantastic thing. But yeah, in most countries, there's rising life expectancy. A lot of diseases that used to kill people are now, yeah, becoming controlled, either as chronic diseases or in a few cases even cured. So maybe that's a reason why cancer seems to be more common. We also have a lot more detection and early detection and screening, that kind of thing. So I think people are being picked up with screening as finding the cancer, or people are going into the healthcare system with another disease and the cancer is discovered. In my case, my cancer was discovered just because of some side effects to an antibiotic. So I had a chest infection, got a very standard course of antibiotics, broad spectrum antibiotics, got a bad reaction. Doctor was a bit suspicious. She pushed me for some testing, and lo and behold, terminal cancer. Not what I was expecting from a cough and some medicine. So finally, why is cancer so hard to treat, and why does it seem almost impossible to cure? Well, it is hard to treat because it's a group of diseases. So drugs for one type of cancer don't necessarily help with another type of cancer. As cancer kind of grows and even spreads in the body, it's almost becoming a different disease. So like metastatic cancer, so cancer that's spread out of the body, out of where it started. So that's like generally a stage 3 or stage 4 cancer. It's fundamentally different as a disease to cancer that's in one place. Another reason, I mean, think about my case, is that there's often no symptoms until the cancer spread. So in my case, when I had these antibiotics, that caused some side effects because there was a big tumor in my intestine, and which caused a lot of pain when I took those antibiotics. So yeah, some cancers are almost only found in late stage. Ovarian cancer tends to be no symptoms until it's spread, which is yeah, very upsetting. Other cancers are in kind of places where they can spread easily. So breast cancer tends to spread quite early, I think, because it can spread through the lymphatic system. So it has access to all those lymph nodes in the chest, gets into the muscle wall, spreads through the body, gets into the bones. Yeah, so that's one reason. Another perhaps obvious reason is that the treatments are so brutal. Cancer treatment is horrific. It's hard to describe just how unpleasant it is. Radiation treatment that burns your skin, makes you go grey, it causes hair to fall out, maybe causes other tumours in your body. Chemotherapy that attacks anywhere in your body where cells are being replaced, so like lining of the stomach, the intestine, all that kind of, all those parts of your body, hair follicles. Yeah, they're really, really, really nasty drugs. The treatments are really nasty. Cancer surgery, so surgeons do something called cytoreductive surgery, where they basically cut out or burn out any visible cancer that they can safely remove. Now, in my case, the cancer had spread a lot, so 6 hours of surgery with the surgeon hunting around to see what he could safely cut out. And then, of course, with cancers like colon cancer, you tend to have bits of your intestine removed. Maybe your intestines can be reconnected afterwards. Very often they can't, so you have a colostomy bag where the intestine comes out of the wall of your stomach and of the abdominal wall, and attaches to a plastic bag to collect waste that you have to empty many times a day. I had that for 5 years. Had a reversal surgery done a year ago, but I still have short intestine, big bit of my intestine removed. That causes trouble every single day of my life from now onwards. With breast cancer, removing either part of the breast, maybe a lumpectomy, or whole mastectomy. Again, with lung cancer, if it's an isolated tumor, a surgeon can do a wedge resection, take out a little bit of lung. Could have to remove a whole lobe of the lung or an entire lung. So patients generally have to stop treatment because, well, either they die or because the treatment is just so brutal. The side effects and the damage to the body is just too tough. So how about actually getting to a cure and sorting out some of this mess that is cancer treatment? So obviously, well, not obviously, but it's important to say that some people are cured of cancer. Like, cancer is a curable disease, and it seems that most types of cancer are curable, and there are people who have been cured. Possibly in 2 years' time, I'll be giving a talk at Hope again, and I'll be saying semi-confidently that I'm a terminal patient who was cured. But the percentage of patients cured is very, very low, and especially the percentage of late-stage patients cured is almost zero. Now, I have to state again, I'm not a doctor. I'm not pretending to be one. I'm a patient who has gone through a lot of treatment. I've studied cancer a lot. I've talked to lots of doctors. I've talked to cancer researchers, talked to hundreds of patients. And I and quite a few Japanese cancer specialists have observed something in Japan over the past few years. In my case, over the past 6 years, which is the time I have been very unwillingly involved in cancer. I basically observed that there are 4 things that help cancer patients live longer and potentially even get cured. So the first thing is the condition of the patient's immune system. Right, so that's really a key thing, because it's the immune system that cures the cancer, I believe, at this time. Meaning that when you have, let's say you have cancer surgery and the cancer hasn't spread, a surgeon removes the tumour, and then you have this microscopic disease left behind. You may have cancer cells floating around in the body called circulating tumour cells. And the immune system hopefully can deal with those and the cancer doesn't recur. The problem with this is that when you have surgery, there's a lot of immune suppression. Right? So it suppresses the immune system a lot. If you have radiotherapy, it suppresses the immune system a lot. If you have chemotherapy, it suppresses the immune system a lot. Now, if you have radiotherapy or chemotherapy, that kills some of the cancer cells. The immune system can see this, hopefully, and starts attacking cancer cells. So you can see there's kind of this like a balance, like seesaw kind of balance between the cancer treatment killing cancer cells, which is obviously good, and particularly destroying tumours that were damaging the patient, but also causing immune suppression. So the condition of the immune system is really, really important. And then access to the newest treatments. It just seems to be a recurring theme when you look at long-term cancer survivors. They got the newest treatments, clinical trials, or just the latest treatments available, or using old treatments but in newer ways, right? What's that William Gibson quote? The future's already here, it's just not evenly distributed. The next thing that seems to be a key factor is the total amount of treatment. So can the patient deal with more and more treatment, especially chemotherapy or this molecular targeted therapy? Can they have a lot of immunotherapy? So you can see already how these factors are related, because more treatment, if they're treatments that damage the immune system, then that's going to tip the balance in the wrong direction. And the fourth thing is the variety of treatments. So long-term survivors tend to have a wide variety of treatments. So there are 8 ways of treating cancer at the moment. I've had 7 of them. And within those ways of treating cancer, so chemotherapy being one, I've had a whole cocktail of different chemotherapies and molecular targeted therapies. I've had 2 types of radiation therapy. So a lot of varieties of treatment seems to be a key factor, and that's probably because it stops the cancer being able to evolve. Like, one of the reasons why cancer survives and patients don't is that the cancer evolves very quickly. Very simple Darwinian evolution, right? You have a cancer treatment, it kills 90% of the cancer cells in your body. The remaining 10% happen to be resistant to that treatment, and that forms a new population of cancer cells. So having a big variety of treatments seems really important. So those kind of 4 factors, I guess you could call them, they suggest to us what a cure should look like, right? Combination of treatments that have less impact on the patient, particularly on the immune system, and treatments with a view to having more treatment in the future, kind of admitting that if the patient's going to survive, they're probably going to need a whole series of treatments. So we should carefully choose the treatments that are going to keep the patient in a good condition. So finally, how would you scale this kind of thing and make it into a proper cure? Some countries have almost no cancer treatment, right? So many countries in Africa, for example, there'll be no radiotherapy, or there'll be 1 radiotherapy machine for a country of 20 million or whatever. Place like Malawi, there's almost no cancer treatment there. Some countries have really great cancer treatment, but it's very uneven in terms of access. So the US would be a good example. There's some fantastic cancer treatments in the US, but not accessible for the majority of Americans. Cancer patients I know in the US who are terminal say that generally in the US you need about $1 million as a terminal patient to kind of live as long as possible with your cancer, right? So if you wanted to do the best, get the best treatments, whatever, it's going to cost you about $1 million. So it's very uneven treatment. In other countries, the treatment is uneven depending on cancer type and age of patient. So in the UK, for example, really good surgical technique, quite poor in other areas of healthcare related to cancer. So overall, quite poor cancer care. I don't like saying that. I'm British. But yeah, I would not be alive 6 years later if I'd stayed in the UK for treatment. Absolutely not. If I was an amazing case, maybe would have lasted a year and a half. If I was one of those amazing outliers in the UK, certainly wouldn't have been here 6 years, because most of the treatments I've had are not available in the UK. Some that are, just the quality in the UK is poor compared to what I've had in Japan. So one thing that we really need to do is use refactoring. So we need to look at treatments that we've already got, that treatments that are effective, or more effective than not. Maybe would be a more honest way of putting that. But refactor them. So without changing the treatment outcome, find a way to make the treatment more accessible, particularly cheaper. And that goes for other medical technology. So things like the CT scanners and the PET scanners, MRI scanners, they are massive machines. They're very expensive. They're not improving over the years. They're still massive and expensive, have very high power consumption. They're so heavy, they are often in the basements of hospitals. So we need to refactor those, re-engineer those. Treatment machines, radiotherapy machines, make cheaper versions, looking at open source solutions. We need to look at cancer drugs where the patents have expired, and then you can make a biosimilar drug, which is a slight alteration, but the drug functions in the same way, and that could be done by non-profit organizations. And again, we could sort of have open source drugs. Especially one thing we need to do is share knowledge among cancer patients and doctors and researchers. So that's one of the big areas I'm working on. So yeah, I educate cancer patients around the world. I run free online seminars about treatments. I have provide information for doctors as well, and I'm working on getting doctors, patients and researchers together to share the knowledge. Obviously in the tech community we know a lot about community and knowledge sharing, but in the medical community, well, I'm not even going to call it a community, but there's a lot less skill when it comes to sharing knowledge, right? Researchers are publishing medical papers instead of making wikis where people can annotate and add comments and edit things, for example. We need to get medical professionals coming to hacker conferences instead of just talking to each other at medical conferences. So as I said before, like if you go to makecancerhistory.jp, you can see some of the work I'm doing. You can get in touch with me. And if you go to hackcancer.jp, you can find out more about my personal situation. You can watch educational videos on living and dying with cancer. I'm always very open to questions and contacts. So find me online, get in touch with me, ask me questions. If you want to help, get in touch. If you need help, obviously get in touch as well, because I'm working hard to make a real difference to how cancer patients get treated. So thank you ever so much for your attention. I deeply appreciate it, and please do get in touch either via hackcancer.jp or makecancerhistory.jp, or just look me up online, Karamoon. You'll find me on Twitter and all those other ridiculous social media things. Thanks a lot.